Hi, everyone. Good morning. I see it's 9:30. So Oscar, if you're ready, I'm going to go ahead and get us started. Feel free to open up your camera if you'd like. We're so excited you all are here. Uh, I just want to say hello and welcome to Supporting Students Through Crisis Situations. My name is Marnie Dow, and I use the pronouns she, her, and hers. I serve as the Assistant Director for Student Involvement at UNLV, and I will be your moderator for this session. As a reminder, we ask that you please remain muted and have your camera turned off throughout the duration of the session. This will help us ensure that the audio and video quality of the meeting is as top-notch. This meeting is being recorded and will be sent to you along with the presentation slides at the conclusion of today's event. If you have any questions, please place them in the chat box on the right of your screen, and we'll do our best to answer them during the allotted time or at the end of the session. Please do not send questions directly to the presenter, as they may not see the chat function while they're screen sharing. Feel free to either send them to everyone or private chat them to me, and I will make sure we get to them. I'm now going to go ahead and turn it over to our presenter, Oscar Sida from Great Basin College.
Hi, good morning, everyone. Welcome, and thank you for attending my presentation. It's an honor to be part of these events, and I think they're a great support to students, and I'm happy to be here. So let me go ahead and share my screen so I can pull up my presentation that I'll be sharing with you today. Okay, so you guys should be able to see my presentation in full screen now. Okay, so I'm Oscar Sida. I'm the program coordinator for Human Services and our addictions programs at Great Basin College, where we have associates, bachelors, and certificates in human services and substance abuse counseling. I'm also a licensed clinical professional counselor, a problem gambling counselor, and a drug and alcohol counselor. I have a lot of experience working with trauma addictions, and I've worked in many different agencies and treatment centers to provide help for folks suffering from mental illness and addiction. And I put together a little kind of brief, but core information. I think that it is helpful to remind students. I think most of us kind of know this stuff, but with training and education, the more we are exposed to this information, the more ready it is to us and available to us when we're facing moments of crisis. And as a human being, we all experience some form of crisis and trauma, but that doesn't mean to say it has to overwhelm us in all instances. And with a little bit of healthy coping, you can bounce back and recover pretty well, I think. And so let's get started, and I welcome any questions. I think that'll be kind of a fun way to stay engaged. I can't see the chat window right now, but let me see if I can minimize my screen so I can see that. Yeah, I can see the chat window now. Okay. Okay, so talking about what a traumatic event is, I think we all know that, but just for the sake of the presentation, that we're all kind of have this shared understanding. So these are sudden or unexpected events that affect people's lives in different ways, emotional lives, feelings of safety and security, and then their capacity to cope in a way that is effective at mitigating the intense emotional physiological reactions. Common reactions to trauma or crisis events can last from days to weeks or even months after. Complex trauma, when we see it in a clinical setting, can last for years if folks don't get appropriate treatment and care. And it isn't always necessary, so I don't want to alarm anybody to think, oh, I went through a traumatic event. I think the term PTSD is thrown out a lot. People say I have PTSD, and it's kind of, it's not really the same thing. And it's almost, I would say, as a clinician and as an individual who treats people who suffer from these severe disorders, it's a dishonorable way of describing what you're going through in comparison to those victims of these very difficult life circumstances. So, we all know that PTSD, or which is just an acronym for post-traumatic stress disorder, is a kind of a whole umbrella of different symptoms that occur when people have sustained, in most cases, multiple traumatic events that have sustained over a long period of time. So situations in combat that where their individuals are exposed over and over and over to traumatic events, and also have a kind of a weakened response from previous traumatic events, like maybe having a really difficult childhood, or having experienced multiple traumatic events prior to entering the military or being in these combat situations, because it doesn't always affect military personnel. Civilians are affected by war just as well. The way we, and as clinicians, we categorize these reactions to trauma is that sometimes they're just a normal reaction, and it takes a few days of adjustment or even a couple weeks. If we see that lasting over a month, then it's usually time to recommend some kind of treatment or interventions that can help mitigate some of these experiences. If it lasts longer than that, then we might intensify that treatment with different types of, could be pharmaceutical interventions, could be behavioral health, could be group therapy. There's lots of different tools we have at our disposal. And one thing that I think that a lot of people don't know is that we have a lot of very effective treatments for trauma. So it's a good time to be able to access those kinds of systems of care and interventions in the world that we live in today. Not all countries and communities have the same level of care, but luckily in our communities, we do have some level in just about every large and small communities we have. Sometimes we don't have enough, but it's available. So some of these reactions can be feeling overwhelmed, not being able to deal with normal day-to-day stress because you're already at an elevated level of distress, difficulty sleeping, and you want to measure these effects compared to how you normally, if you normally don't sleep well, then it's not that you're experiencing these symptoms. That's just kind of your normal. Feeling distracted, feeling afraid or unsafe, and some other signs of stress include physical signs that could be nausea, upset stomach, tremors that can be like your lips shaking, your hand shaking, feeling uncoordinated, profuse sweating, chills, dizziness, rapid heartbeat, head and muscle aches, or overall just kind of blah, and I think as responsible individuals, we have to pay attention to those signs and symptoms to say, oh, I don't think I'm doing well, and maybe I need to reach out and access my support systems and or look for professional care. So those are always important things to consider as we're experiencing these kinds of things. And just because you have a traumatic event doesn't mean that you're going to, I'm sorry, there's a hummingbird outside my window. It just gave me a smile. Just because you experience a traumatic event doesn't mean you're going to have these things. But you might experience them in some shape or form, in lower intensity, higher intensity, higher frequency, lower frequency. When as a therapist, when I'm working with a patient, I'm looking at how intense these experiences are and how frequent they're happening, to kind of gauge what level of care they might need, or how I might best address these symptoms. Some emotional symptoms of stress from these reactions could include anxiety, fear, guilt, grief, depression, sadness, crying, anger, irritability, shock, loss, feelings of abandonment, numbness, denial, isolation, feeling alone, excessive worry about others, wanting to hide from other people, and then limiting your contact with other folks. And for a short term, this might be kind of a normal reaction, but you don't want to self-isolate and withdraw from people, because we get strength and support from others. And without that kind of energy exchange between our support systems and our communities, we are alone. And sometimes when we're not feeling good, it seems like the right thing to do. And I think, realistically, for a little bit, it's fine to be alone with our thoughts, and but sometimes you can get swallowed up by those feelings of despair and kind of slip away. And it's so important that we re-engage with other people and kind of our active daily living, the things that we typically will do. You start to, that's why it's so important. They say, when you fall off a horse, get up and get back on. That can help keep the process from setting into be kind of a new way of being, which human beings are creatures of habit. We tend to repeat things, and to find some sense of security, we have routines. You probably notice these routines in your own daily life, as I mentioned it. And so what you don't want to do is kind of derail your normal activities and then kind of take on this new one where you're isolating, you're not going out, you're not doing things, you're not taking care of yourself. And that can happen. You'll notice, I'm sure you all know the custom that many of us do when someone loses a loved one, there's a death in the family or friends, will take over food to the person that's really greatly affected by the loss, because sometimes it's hard to get out of bed and cook a meal for yourself or take care of yourself, so people tend to stop eating. So one way to keep people healthy is to share a meal with them, or to show that you care, or just, even it's a pretext to dropping by to see how people are doing. But I always thought that was a nice custom and a nice gesture to offer someone sustenance, food in a time of crisis, because I think sometimes we even forget to eat. We were so overwhelmed with our emotions. And I don't want to alarm anybody. These things happen. We are wired to respond and to recover from these events. It's when people face them over and over and over that they're at higher risk of developing pathological disorders to traumatic events. And they're not even they're kind of logical and rational when you think about how much people have to go through sometimes. And I think the biggest worry is people become afraid that things are going to happen again. And the fact of the matter is they do. This is part of the human condition. We have good days and bad days, and good experiences and bad experiences. So it's important to be open and accepting of and understanding of the way things are, not the way things we might wish they could be, because that could create an attitude where we resent life, we resent having to go through these things, and then we lose kind of the gratitude for being alive, for doing things that enrich ourselves and others, and even finding a way to find meaning through your loss, which will happen kind of at late stages of recovery from these reactions. Some of the mental symptoms you might notice after a traumatic event is slowed thinking, what they call like foggy brain or foggy thinking. Difficulty making decisions, feeling indecisive. Like normally I'm a pretty decisive person, but I might notice myself like, just not even knowing what to eat for dinner or what shirt to put on in the morning, like finding it more difficult or having to exert more energy in a task that is pretty common and simple for me. Difficulty with problem solving, confusion, feeling disoriented, especially at a place and time, not knowing what day it is, not knowing what time of day is, not kind of feeling yourself, feeling like someone else or you're outside of yourself. Difficulty concentrating, problems in remembering things that if you normally have a pretty good memory. Difficulty naming common objects, what we call proper noun loss. Distressing dreams, and poor attention span. And your mind is in a process of healing, and a lot of that energy is being taken place for you to kind of come to this new normal, to this new way of being. And there's a lot of changes occurring. And just like the body, the mind has its own natural healing processes. So these are things we expect as professionals when we see them. We don't get alarmed when we see them. We recognize them as the natural healing process, and we help clients understand and encourage that, because depending upon your own personal individual experience, this might be the first time you've ever had something really major happen. I remember when I was in high school and, one of my grandparents passed away, and I was like, wow, this is like the first of many deaths that I'll experience in my life. And it made me depressed to think about that. And then of course I kind of pull myself out of it and get used to the idea and these what these new experiences mean for me. And I would say one of the things that I came to recognize that is, even at a young age, is that life is short and I want to enjoy as much of it as I can. And one of the ways that I enjoy life is helping other people. And that's been my passion as a professional, as a professor, an educator. I really find that some of the best way to spend my time is helping other people. So when I was asked today or to participate, I was like, oh yeah, that'd be great. I'd love to engage some students across the NSHE schools and to share a little bit of my knowledge and experience with you folks. So dreams are often kind of can be really confusing and distressing. And what I would try to remind you is that dreams are there as a means for you to process information that is sometimes difficult for your conscious mind to process. When I work with folks who are grieving the loss of someone, and loss doesn't have to come in the way of death, it can come in the way of an end to something, like loss of a job, loss of a spouse, loss of a relationship, loss of a friendship. Those will produce grief reactions, and sometimes it's surprising to us how strong those grief reactions. They're just as strong as losing somebody through loss of death or something of that nature. And even loss of our pets can be really profound grief experiences, because they mean so much to us and they're such a big part of our lives. So what I try to remind clients, and I want to help you guys understand, is that not judging your reaction isn't helpful. Like, let yourself feel the way you feel. It's just a thought, it's just a feeling. It doesn't mean you believe that, but it is a part of your experience in processing things. So before I get too far along, I do want to stop and take a breath and see if there's any questions that coming up from the group. It's not going to all be bad. We're going to get to some good stuff, right? I know I'm loading you up with a lot of negative, experiences, but okay. I'm not seeing anything. I'll just continue then. So what can you do? How can you help yourself? And I've talked a little bit about this. Recognize that what your experience is normal. These are normal reactions to these events, and they will ease with time. And sometimes it's a little bit longer than you'd like, but they do tend to recover on their own. So like I said, I was talking about that natural healing process of the mind that gives you an opportunity to recover. Avoid comparing yourself with others, like why are others doing better, bouncing back faster, or why am I not reacting at all? You might have a kind of a blunted or numbing experience where you just don't feel anything, and you might feel guilty about, well, what does that mean? Do I not care? Or something, you start second guessing those reactions. And I think what we can say is that everyone goes through these experiences in their own way. When we identify these other symptoms, those are just things that most people generally go through, but it doesn't mean everyone will react the same way. And it's okay for you to have your own reactions. Just like some people find things funny, other people don't. We're individuals, and the way experiences hit us are unique, just like we are. Avoid using alcohol and drugs to cope. This is a big one. This is where people tend to pick up these habits, because in the short term it works, right? You're in a very stressful emotional state, and you have a drink, or you use recreational drugs, or even prescription drugs that you might have, that you notice, oh, I had a knee injury, and when I take this Oxycontin, I kind of zone out, and that's sometimes that's a pleasant experience for my own mind, because of my stress and emotional problems. But then what you'll find is over time it creates more problems. You start to check out from your relationships. You stop taking care of yourself. You stop doing things that you enjoy. And so what addiction does is it takes away all the other things that support your life, enrich your life, and make it meaningful and worth living. And all you're living for is the this relationship, this maladaptive, dependent relationship with this substances. And that can be drugs, alcohol, that can be behaviors such as sex and gambling. And what you'll find is that as we increase tolerance to those that behavior that is common hallmark of addiction, is that you'll need more over time to get the same effect. So like if I have one drink or one beer and I feel relaxed and calm, the next time I'll need two, and then if I keep going and abusing it, I'll need more and more and more. And this will, and of course, drugs and alcohol are toxic to our bodies in high doses. So then this will make you feel worse physically, physiologically. You'll feel depressed, anxious, just generally disease. And then you'll think, well, when I drink, I don't feel these things. So you'll start doing that again. And it's this, this cycle that kind of, it's self-replicating and very destructive. And this is why addiction is such a serious problem in our society, because these things are readily available and they seem to quell our symptoms, but the effect is short, and it's not doesn't lead to higher levels of growth and functioning. So we become dependent on this. Where if you allow yourself to experience these things, you'll naturally build tougher defenses, a better understanding of yourself, incorporate those experiences in eventually healthy ways, so that you can better cope with higher levels of stress and distress. And so you become stronger. And so these things that seem devastating are still, they're still going to bother you, but they're not going to overwhelm you and kind of put you down for a while. Try not to fight recurring thoughts, just let them come and go. And I always like to tell everyone, don't believe everything you think. Sometimes we have errant thoughts or obsessive thoughts about certain things. And I always tell my patients, I remind them, you don't have to believe what you think just because you think it. Evaluate it. Is it helpful? Is it useful? Is it rational? Is there evidence to support it? And once you turn it around a little bit, sometimes those delusions will just disappear under the scrutiny of your own rational mind. Other times they might be symbolic reactions to your experience. They might tell you something about understanding yourself kind of in a deeper way, in a more emotional way, in a spiritual way. They don't have to correspond to logic and reason, but still have value and meaning to you as an individual. So I think the biggest issue I see is people trying to suppress their thoughts, like just don't think about it, don't do anything that reminds me of it. And then what they do is they get stuck in one stage of the healing process, rather than allow themselves with the opportunity to heal and grow. This is like, I might say, somebody who has like a cut on their hand and they keep, poking at it or picking at it, and they're interfering with that natural healing process rather than letting it take its course, and in time it will recover on its own. Try to maintain a normal schedule if possible. Even if you don't feel like it, do it. The kind of fake it till you make it mantra. Sometimes that can help. I always tell everyone, nobody sat on the treadmill. Even if you can walk a mile on the treadmill or go outside and get some sunlight, get some exposure to the air, to trees and birds and the natural environment, those are really healing and therapeutic experiences. I find hiking personally and we have no end of trails in Nevada, and we usually have pretty good weather. Even our bad weather is pretty good compared to most places. Now we do have to take mind to the heat down here in the south. We get some brutal summers, but you just get up there early, and it's very pleasant too. But getting out and doing those things can help kind of offload your mind to other things, so you're not constantly thinking about what happened, or maybe if you're anxious about what will happen. And then don't be shy about mobilizing your resources, accessing friends, family, even professional support such as mental health counselors like myself if that's necessary. One of the great things about the new generation, I call the one coming up behind me, is the stigma around mental illness is not so great. There's a lot less of it. And I've seen in previous generations, like my folks and my grandparents, that was something that nobody talked about. And me becoming a mental health counselor, it gives me great hope for the future that we're able to recognize these things early. We're able to, without bias or shame, access these resources and then recover from them much quicker. Because what we tend to see is people come to us when they're really desperate, when they've gotten so low, and what would have prevented that from getting to that stage of pathological functioning is to have access services sooner, you know. Okay, so what else you can do? What else you can do? What else can you do, I should say? Take good care of yourself and others. So getting proper nutrition, sleep, enough sleep, sleep hygiene is one of the most important things that you can do for your health and well-being. There are almost every major mental disorder is highly correlated with poor sleep hygiene. So if people aren't sleeping enough or they're not getting restful sleep, we always see that as a common factor with major mental disorders and poor health in general. So if you're getting good sleep and getting good nutrition and, you know, not eating unhealthy foods and eating reasonable amounts and things like that to support yourself, that's going to do a lot of good for you. Getting some exercise. If you do those three things, you'll pretty much recover from just about anything. You know, I see most people who are really active and healthy and high functioning and have high tolerance to distress and traumatic events. They engage in these things. And what you don't want to do is wait till something bad happens to start doing this. This should be part of your daily life and your daily rituals to tell yourself, I'm important, I matter, my health matters. I care about how I treat myself and my body and my life, and it's important to me. And when you're not doing these things and you're kind of doing the opposite, you're not exercising, you're lethargic, you're eating poorly, you're sleeping poorly, you're using drugs, alcohol to cope with life or just to feel some sense of happiness, or you're checking out, playing video games for 8-12 hours and then trying to function in the next day. These things, or you know, and it's not just drugs, you know, alcohol, it's other behaviors. And in the technological world we live in now, we have to use technology responsibly. If you're on YouTube for, you know, 4 hours or something like that, this is not healthy, and it can create other problems. And these can be dependency, just like drugs and alcohol. They're ways of distracting, numbing, and escaping emotional experiences in your life. So good exercise, diet, sleep. I'm just going to push on that because I want you to feel that discomfort if that's not something you're doing, and thinking about why, and maybe finding some ways where you can increase the probability that you're going to engage in a healthier lifestyle for yourself. Because when folks who are healthy experience these traumatic events, they're better able to recover and to cope in a healthy way, rather than folks who are already kind of a low level of functioning because they don't have a healthy lifestyle. Then they'll tend to have a poor response, or more of more likely to fall into like a pathological level of functioning. Utilize relaxation techniques, you know, that can be listening to music, going for a walk, doing some guided meditation. There's a bunch of YouTube channels that do that. Yoga. Yoga is really cool. I don't practice it very often, but the times I have, I've noticed a great release and a calming experience after the fact, where normal exercise sometimes can leave you kind of exhilarated, and exhausted, but it isn't really calming your mind so much. And some of these more mindful techniques have become really popular, and they've been around for thousands of years, and we adopted a lot of these from Eastern philosophies and things like that. But they really are helpful and useful. One of my favorite ones is progressive muscle relaxation. I really enjoy when I get stressed, or I'm in a situation where I'm uncomfortable, but I need to maintain kind of a cool, calm, collected state of mind and being. I will just tense muscles, take a deep breath, hold it, release those muscles, and you do that progressively. So you might start with your feet, doing it and counting for like 5 or 10 seconds, holding your breath, and then exhaling and releasing it. And then you go up to your different muscle groups in your lower legs, and then in your thighs, and then in your torso, and then your chest, and you just go up and up and up, and then you can go back down again. And I'll tell you, if you try to do that before to bed, people say, I have trouble sleeping. I'm like, try it. Every client tells me they fell asleep within minutes of doing it. They're like, I was like halfway through, because those are natural relaxation responses that we can access by certain intentional actions. We can activate that response. And then let's not forget to ask for help from others. Talk to others about how you feel. Ask them if it's okay. Sometimes we can overwhelm folks with our own problems, but most people, especially people that are close to us and care about us, they want to help. They don't just want to be your friend or your loved one when things are good. They find it meaningful that you come to them and that you lean on them when you need to, and then that affords the relationship to grow and strengthen, and then they feel in turn trust, and that they could come to you in times of need too, because we're all going to go through things, and the stronger our support systems, the more better we are able to handle that. Marnie, I don't know how much time I've got. I want to make sure I don't run out of time. I think I'm at a half hour right now.
Sure. You've got until 10:20, so feel free.
Okay.
And I've got 1 or 2 questions that are coming in. Make sure we get time to some questions at the end, but you're doing okay on time for now.
Okay, yeah, so I'll just continue, and then we can do all our questions at the end, if that's okay. I don't think I've got too much left, so I want to give ample time to questions, and then that might spur some additional discussion. So, and then also consider seeing a therapist and mental health professionals. There are different types and sizes and methods that we use, and finding one that really fits you. And if you go to a counselor and you feel like this isn't a good fit, or I didn't really like my experience, don't think that's going to be the only experience that you could have. You might just have not gotten a good fit. Typically, we're trained in similar ways, but there are different types of experiences that might work better for you. And so what I tell clients, don't give up. And I'm fairly open with them too. I'm like, if you don't feel like we're connecting, that's okay. I can refer you to some colleagues, maybe if I get to know a little bit about you, I can find a better fit for you. But let's give this a shot and see if we can't help each other, help you. And that's really kind of what counseling is. We find ways to help the individual help themselves, and then we support them through that experience. It's nothing mystical or magical about it, but it is profound. And what people find is that they have their own resilience and source of information for them to recover and to heal, and that's very empowering. And I try to work from an empowering perspective, where I look at people's strengths. I don't focus too much on the pathology, the symptoms. I focus more on where they want to go, what they want to get. How can we reduce or eliminate those symptoms so that, to get back to level of functioning, or higher levels of functioning if that's what their goal is. And sometimes, a lot of times when people leave therapy, they feel like they're stronger than they used to be. And I like seeing that growth experience happen. Okay, another really important aspect of being a human being is caring for others. Not just, trying to take care of yourself, but validating other people's experiences, no matter how strange or different they might be from your own way of thinking or being. So important that we hear people, we listen to them, and that we reflect, that we understand, not by saying, yeah, I know, but by saying things that they've told us as a way um, uh, of signaling to them that we know how they feel because we are listening to them. So that's what I call what we call active listening in the profession, or and those responses require three three elements. One is the emotional experience. So, like, say, if Marnie had told me, this experience she had that was very distressing to her, and I could say, "Wow, I can tell you're really anxious about what happened." And as I'm listening more, there's the emotion. That's what I call the emotional response, the reflection, and then see the content of why she's anxious, because this has happened before, and she's afraid it's going to happen again. And then that's the content part of it. So emotions, content, and then M, the last one, meaning. What's it mean for her? Well, it means I feel unsafe in this relationship, or I feel safe in this situation, because if it keeps happening, then how can I feel safe and secure within the confines of these types of experiences? So I'm being kind of general because I don't want to get too personal. I'm just using Mari as an example, but so when we validate, we really want to listen. The worst thing people can do when somebody's trying to tell you how they feel is you start talking about your own experience. Like, oh, when my grandma died, people always do this, and it's more of an associative response that happens in the mind when you talk about certain subjects. Our mind kind of puts focus on experiences similar to that, but this can make people feel like ignored or invalidated, or you might say, oh, I know exactly what you're going through. A lot of people say that, and it's the worst thing you can say. Just say, I'm really sorry, I can tell this really hurts, and I'm here to listen, or I'm willing to listen, and just listen. And people say, well, I don't know what to say. Well, sometimes there isn't anything to say, there's just being, and offer some support, and kind of a caring attitude. But you don't have to solve the problem for them, because that's rushing through it. It's almost like saying, don't feel like this anymore, just be okay. But and that can make people feel more alone, and like they don't have anybody to talk to. Expressing concern for others and their well-being, and find ways to help them keep safe. Checking in on them can really be important. And then be flexible in understanding their reactions. It just might not look like what you might do, but that doesn't mean it's wrong. It's just how they're reacting. Now, if it's destructive, then you're going to want to lend a wise bit of words with them to make sure that they don't slip into their own dysfunction. Allow them time to talk and process what happened. Don't try to rush through it. A phone call, face-to-face, those go over a long way. And then avoid saying things like you'll get over it, or ignoring what happened, like as if it never happened. And don't force the issue. If they don't want to talk about it, that's okay too. But letting them know, even if people don't ever come to you, but and I've heard this many times, people say, just that I knew that I could go to this person helped me feel like I could get through this. Like I had a safety net, so to say. Okay, so that's the end of my presentation, and I'd love to answer any questions or hear any comments or questions that you might have from the group.
Okay, so if anyone has
there's a lot of folks on here. I didn't know there was that many.
Yeah, we've got 60 participants here. It's great. I want to remind everyone, encourage you to put any questions that you have in the chat, either to everyone or directly to me. That's fine. But I actually, and while you were talking, I figured I actually had a question come up, so maybe I would start the questions with that while we wait to see if anything comes in. Something, as someone who works with a lot of students, and I know there are a lot of people on this call who also work with a lot of students or a lot of colleagues. We're in such a diverse environment at our institutions, and there are a lot of cultural barriers for a lot of our students and colleagues to asking for help. So maybe if you could provide any suggestions that you have to help us when we work with students or colleagues about how to maybe help overcome some of those cultural barriers to even asking for or accepting help in the first place.
Yeah, so these cultural norms, you could say, or attitudes, beliefs, they run deep. And so what I would say is not to try to confront them, but just to recognize that you're part of a student community where our culture is to help one another and to support one another. And the belief that it's okay to ask for help. And that's one of the reasons we provide that. So I would say adding to their own cultural understanding of themselves by the institution's culture is a helpful way to I would say get around it, but to add to it. So because we all belong to multiple cultural and groups in that way. And so that's a way that doesn't necessarily confront maybe the culture that they come from or they identify with. But it helps to enhance it by adding an additional one. And that's one way I might do that, so it becomes a non-issue. It becomes okay, like I think we find a way to validate where they're coming from, but also to add to their understanding of who they are as being a part of their student body.
Thanks. We had one question come in. Jennifer's asking, can you give us some ideas about how to incorporate this into working with students?
Yeah, so a lot of these like these talking points here, I put them on there for you to be able to just like look at it as like a cheat sheet. So you can like when you're working with a student, I can't want to say patient or client, just kind of give yourself a quick reminder of what you can do. And then this will give you a little bit of confidence on how to support the student. One of the most important things for you to recognize within the individual is they have their own resources to mobilize themselves to recover, and to let them know that while it's difficult at this time, these are difficult experiences. You might have had some other experiences like this and recovered from them before, but you always want to gauge where they're at in the process. You don't want to say something that's kind of out of step with their experience, so it makes them feel like you're trying to placate them or make them feel like it's not that important of an issue. The most important thing is listening to people in a really patient and open way that's non-judgmental. And this is something that we do as therapists, and I train mental health professionals. It's one of the roles that I, as a clinical supervisor, and I will tell you, it doesn't matter how experienced and educated the clinician is, we're always going back to basics. We're always enforcing this fundamental. And it's something as lay people or as other professionals with different roles can always do for each other that has no, there's no therapeutic or professional prohibition on helping other people in this way. It doesn't matter where you're at, who you are. Listening is such an important way of sharing people's lived experiences and helping support them. And so I would say that's the most important thing you can do. I think when Jennifer and a lot of folks ask me questions like this, they want to know, what's the solution? There isn't a solution. The solution is the experience, and being supported through the experience is the most important benefit for working with folks that are dealing with this. I have a contract with a company called R3 Continuum, and one of the things they do is they dispatch therapists out to sites where a crisis event has occurred. There was a suicide at work, or there was a shooting, or there was a natural death, or an accidental death, or something really significant like that. And I use these same set of skills, and I've done it for years, over and over with these folks. And recognizing healthy coping, reminding them not to engage in unhealthy coping, reminding them to reach out for help if they feel like they're not recovering kind of what would be expected or normally, and those kinds of things can go a long way to help them recover. And of course, always having resources to professionals that they can refer them to. It's like, wow, I can see this is really affecting you, and you have my sympathy and concern. And I wonder if that, if you don't think things are going well, that you might be interested in accessing, our counseling resources, or I could give you a name to a few different agencies or professional counselors that you might be interested in working with. And that's something that can provide another safety net, so that, like, okay, so this is our plan. Like, if within this amount of time, or if you want to, we can just do a warm handoff. I'll call them up and just introduce you, and then have them the phone, and you can schedule a session with them, or whatever you think is appropriate at that time. I hope that answered your question, Jennifer. I see another question from Margie. Let's see.
Sure, I'll go ahead and read it. With COVID-19 and restrictions with human interaction, what have you found helpful for patients or clients to help bridge that loss of human connection, especially during times of crisis?
Well, getting out into nature, when you're in nature, it's a way of being in solitude, but also being a way of being surrounded by living creatures and the natural environment itself, being near water. And luckily, living in southern Nevada, most of Nevada has a lot of great places to be outdoors, lakes, rivers, streams, mountains. In the desert, I'm a big fan. I was born and raised in Las Vegas, and the desert is my home, and I really enjoy taking nature walks. And it doesn't have to be, like a death march through the desert. It can be just a stroll where you kind of pay attention to things. And I was out at Red Rock a couple months ago, and I didn't even know we had elk out there. And this thing just strolled right past me, and it was at dusk, and I was just awestruck by the sheer majesty of the animal. And it was in that kind of stage where the horns aren't just hard yet, but they're like soft. They look like kind of bristly sponges, and it was such a neat experience to see right up close. It walked right past me. It was a few feet away from me, and wasn't scared of me or nothing. And anyway, I found that a very tranquil experience. It's probably one of the reason a lot of us keep pets, because being near nature in some way, shape, or form really provides us a reassurance of feeling safe and comforted. Other things that you might do is, of course, use technologies to bridge those gaps, like Zoom. I wouldn't say social media is the best way to do it, because I feel like that has a lot of negative consequences because the way it's utilized. But phone calls and reminding people that you're here and you're thinking about them is a great way to stay connected. Because if you send a good morning message to somebody, you're the first beneficiary of that act of kindness. You feel good about it, right? If you send somebody a nasty message too, conversely, you are the first person impacted negatively by it, because you're experiencing rage, anger, or whatever resentment thing. And you want to think about that. So how we react to our stress can go a long way in how we recover from it. So not giving into those negative impulses can be really helpful. I hope that answered your question, Margie.
That was great. So I'm looking at the time, seeing we're coming right up to that 10:20 mark. I want to make sure everyone gets that 10-minute break before our next session. Oscar, can you do me a favor? Can you go back to your last slide, because it's got your contact information on it? I had someone ask if they can get your email for follow-up questions. So I remember it being on your last slide. oscar.sida@gbcnv.edu, and I will type that in the chat real quick in case anyone can't see the slide. But understanding we just have about a minute, Oscar, is there any last parting words you want to make sure you say before we head out?
I just want to thank everyone for their time and attention, and feel free to contact me if you have questions or like some follow-up discussion. I would welcome that. And just ultimately recognize that while these things are part of the human experience, they don't define us. And ultimately, once we recover from these, we can find new meaning in loss. Because loss doesn't have to be a negative experience. It can be is part of the life experience. There is life, and then there is and growth, and then there's decay, death, and loss. And those are two sides of the same coin. And when we accept that attitude towards life, we can more fully embrace and live life rather than feeling like we have to suffer through it. But with that, thank you, and I'll close. And I really appreciate your questions, and I hope everyone has a great day and rest of the conference.
Oscar, thank you so much for such a great presentation. Thank you all for joining us. Don't forget to check out, you've got a 10-minute break, and then log right in for your 10:30 sessions. Have a great day, everyone.
Bye.